Alrighty. Thank you all for joining us today to learn about how to deliver a perfect patient experience. My name is Taylor. I'm Raider 8's marketing manager, and I'm just here to quickly let you know how to ask questions and make comments as we go along the way. There should be a Q&A button toward the bottom of your screen. If you click on that, you should be able to type in a question. If it's topical and we have time to answer it in the moment, we'll go ahead and do that. But otherwise, we will save questions until the end. Please don't hesitate to ask questions as we go along. And with that, Ron, let's take it away.
Thank you, Taylor. Hello, everybody. Welcome to the webinar. I'm going to introduce myself and then give Amanda and Brad the opportunity to introduce themselves. My name is Ron Chorzewski. I'm a senior solutions consultant with Raider 8. I've had the privilege of being a Raider 8 client and working with Raider 8, so I've kind of seen it from both sides of the fence. I'm excited to be with you today. I'll turn it over to Amanda for an introduction. Maybe you could tell us a little bit about your practice too, Amanda. Thank you.
Absolutely. Hi, everyone. My name is Amanda Picioccio. I'm the Patient Experience Supervisor at Gonzaba Medical Group in San Antonio, Texas. I've been at Gonzaba for almost 4 years, and for the entirety of that time, we have utilized Raider 8 for our Net Promoter Score and our patient surveys. Gonzaba Medical Group is a Medicare-based It's a Medicare-based company that focuses on patients that are 65 plus, and we really cater to those patients where we can really manage their care and provide value-based care.
Thank you, Amanda. Brad?
Yes, sir. My name is Brad Angeron. I'm a practice administrator at Cardiovascular Institute of the South. I'm located in Morgan City, Louisiana. Furthest south of the boot you can possibly get, I would imagine, close to the Gulf down here. And anyway, CIS, we serve patients in 21 locations throughout Southeast United States. Our mission is providing our patients the highest quality cardiovascular care available. And with that, Raider 8 has been great with assisting us in that mission to provide that to our patients. So previously, worked in a variety of different industries. Most recently, I was the manager of financial operations at Ocean Health, and CIS is where I'm at today.
Great, thanks, Brad. On behalf of Raider 8, we want to thank Amanda and Brad for volunteering to do this. I'm not sure if we volunteered them or if they did, but thank you. Appreciate you being here. We've all used Raider 8 for two major purposes, right? We've wanted to build online reviews to make our practices represent the quality of what we actually have within the practice. But we also collect great patient satisfaction survey data, and we put it into this unified patient feedback platform that allows us to kind of manage the experience of patients. So I'm excited about that being the subject that we're talking about today, right? So we can, in some senses, we can set it and forget it, right? With Raider 8, because they do such a great job of building up the online reviews. But it's up to us as practice administrators to take the data, put it to use, and make changes within the practice. So I'd like to kind of start with that and maybe just throw out a question to Brad, because there's so much data, right? There's so many data points to look at with Raider 8. How do you make sure that that data is being appreciated and processed and utilized within the practice?
Yeah, so it's really a daily thing. I know for myself, I log into, of course, the Raider 8 system, digging in data, a lot of the benchmarking reports and provider feedback summary reports that are also offered. There's a lot of new advances in the business intelligence portion of Raider 8 with, I mean, like you said, just so much data at our fingertips. However, we also utilize monthly meetings that we've set up with our practice administrators at each of our locations and clinics here at CIS, where we could just get on a call together and discuss, what the data is looking like. How can we best utilize it in our efforts to enhance the patient experience? And on those calls, we're able to feed off of one another. What's working well at one clinic might be something that we could utilize at another clinic. And I mean, data's data. Coming from a financial background, numbers don't lie; they tell you the truth. And so, so just a lot of information that we can use to enhance that experience. We also send out weekly communication, to our corporate office, as well as our practice administrators, our patient experience advocates that we have weekly, so that we can just use the data, see what it's doing. Benchmarking reports are great, breaking down, question by question areas that we can focus on, and just work to enhance our star ratings that we're trying to achieve and create that good experience for each patient.
That's great. I know at Rate, we hear a lot from practices that say, I don't really want to do reviews because I'm afraid of bad reviews. And I think when you sit down with a group of practice administrators and you go over the data, sometimes there can be a negative connotation to that, but you really have an opportunity. And I'd be curious to hear from you about how you pull in and just make it a positive experience for folks, rather than like focus on negative reviews. Maybe you focus on the offices that are doing a really good job in certain specific criteria. So anything to add about that?
Yeah, so I know we have some clinics. I mean, of course, some of our lower scores around the entire organization is wait times. However, we do have some clinics that do well with some of their wait times, either in the lobby or in the exam room. So in those monthly meetings, one of those clinics might have some tips and tricks on really what they're working on in those specific areas. As well as perhaps scheduling experience or checkout processes. Some of the we recently had a clinic discover that they had some negative reviews around their checkout experience, and through conversations with other clinics and myself, we were able to troubleshoot that checkout process, that they can maybe enhance it going forward. So that's right. It's not only focusing on, what we might not be doing well with, but we're able to see where we are successful and pull that information from one another just to assist us.
Great. Thank you. Amanda, I remember you had mentioned to me in a previous conversation that you have some custom Net Promoter Score reports that you create. So I'd be curious to hear how you do that and how you use that data within your practice.
Absolutely. One of the great things about Rate is we were able to work with them and really focus our dashboard onto the type of clientele that we have. We have fee-for-service patients as well as our managed care patients, and we look for different information for each of those groups. So we're able to look not only by location on Rate, and we have 7 different locations, and that does not include our 3 different urgent cares. We have PT and PM&R. We have our palliative care. We have a lot of different departments at all of our different 7 locations, and all of those locations see both our fee-for-service and our managed care patients. So having our custom NPS file really allows us to drill into the information that we care about for each demographic, and then find our little pieces of gold and those little nuggets of information that we can move forward and make a meaningful change in that patient experience.
That's fantastic. I was really impressed to hear what you do organizationally. It's very sophisticated at the Gonzaba Medical Group with regards to looking at the trend of negative reports, looking at even physician retention numbers, like physician retention of patients, I should say, not the physicians themselves. But can you speak to that? Like, it's so sophisticated. I'm curious how you make it work so well.
Oh, well, I appreciate that. Patient experience, it's been a new department. It actually started when I first came to Gonzaba Medical Group about 4 years ago. And I kind of view it as a giant tree of patient experience. And within that tree, we have all these different branches, and those have all separate limbs off of them. So within patient experience at Gonzaba, we have our patient advocates, and we also do surveys on them. And those are front-facing and back-facing individuals and employees at Gonzaba that have intimate knowledge with how we work, our insurance plans, things like that, and they address our patient concerns. And some of the survey questions we asked for those were a lot of active listening questions. Did you feel they addressed your issue? And then, of course, if a patient feels that their problem was not addressed by the patient advocate, we're able to follow up on it and try to figure out the root of that problem. We also have a call quality team on our patient experience department. We also have patient retention, which is what you spoke about, Ron, was we find out at the end of the month how many patients left from which insurance companies, and maybe they switched insurances and stayed at Gonzaba, or they left Gonzaba entirely for a different reason. Our patient retention team will call those patients that have left and find out the reason that they left. And if it's something we can fix, we do our best to bring that patient back. One of the great things about Radar 8 is that there is that patient identifying information if a patient elects. So if a patient has been with Gonzaba for maybe 2 years and they've disenrolled from Gonzaba and our patient retention team calls them, we're then able to look into Radar 8 and find, okay, they did complain about the wait time and urgent care in September, and then they came again in December and they had a similar wait time experience. What can we do to really help that patient? Are we able to give them an earlier appointment? So it really just provides a bigger and more detailed background on a patient by patient basis. We also have our patient outreach department, and those are our employees that will call a patient if they have been moved to a new PCP, a primary care provider, and they'll confirm that, hey, are you okay with this new provider that we've assigned you to? And we also have our complaint dashboard, and we have a specific employee assigned with that. And all of our complaints, if we get complaints from Radar 8, from our call center, from a walk-in basis, they go into our complaint dashboard, and that employee is able to follow up appropriately and discover ways to help that patient, or maybe they need to go to a new location, maybe they just want to speak to management, and they mitigate that way.
Fantastic. I'm curious, when somebody's left the practice and you make those efforts to kind of figure out why and bring them back into the practice, how successful are you at doing that?
I would say we're very successful. I believe last year we were able to bring back over 100 patients, maybe 140 patients. And we had probably lost probably over 300, but some of those are non-service related. So those are patients that left because they moved out of the service area. Those are patients that have passed away because we cater to an older demographic. Yeah, a lot of patients leave because they pass away, they move locations, maybe they were moved into a SNF, so we're no longer able to care for them, but we were able to bring back around 140 patients, and that is a confirmed number because we work with our management team and they make sure those patients follow through and are put into a new appointment.
That's great. And I'm curious of the correlation between when you have a conversation with somebody about why they left.
Mm-hmm.
And then you kind of look back at Radar 8. Do you see the correlation there with the data?
I would say yes. If a lot of patients are saying, I've been going to urgent care and we're having a really long wait time, we can look back into our data and see when they went and see, was it just a one-day bad experience, or is this something we were seeing for that extended period of time where we can start working and trying to fix it for the future?
Love it. So kind of a question to you both. Is there a threshold for a complaint? Like how many times you have to hear a complaint before you'd be willing to make a change? Or does it depend?
Brad, do you want to go first?
It doesn't matter, I can.
Go for it.
I wouldn't say that we have a specific threshold, just depends on, as you said, case by case. Sometimes we've seen multiple comments coming through in regards to the same thing. So it shows us a definite need or area that needs to be fixed. However, there have been some one-offs, scraping through the data, looking at 1-2 star reviews, seeing what those comments are. That I'll take a screenshot of it, shoot it over to a practice administrator when I see it. And it's awesome when the patient leaves their information that the practice administrator is able to see that, kind of go back and review what might have actually happened in that visit to try to take care of that. There are some things we'll do. Lost my train of thought.
It's okay.
As far as some recovery things, man, I forgot where I was going. But yeah, some one-offs. I know one that I was thinking of. I actually mentioned it the other day, but as far as we've seen some negative feedback coming back from our lobby waiting areas, as far as news channels and different things that we were displaying on some of the TVs in the lobby area. So we were able to put our heads together. My boss, John, shout out to you if you're on the call. He had reminded me of this, but we were able to purchase some Fire Sticks for our TVs and upload some CIS information on there, different commercials or different little food TV show type things that we put together for our patients, and just a lot of marketing type stuff that we're able to upload on those Fire Sticks, plug them into our lobby TVs. And that way our patients are actually seeing some CIS information and not what's the latest and greatest happening in the world. As far as the news go, we know that can create some high blood pressure as you're coming into a cardiovascular clinic. So we're able to utilize that. You know, we saw a trend in negative comments. We're able to put our heads together and fix that issue. And there was several teams that got to work together on that, marketing, our practice administrators, some of the corporate folks and all that good stuff. So we were definitely able to do that. But yeah, we take a look at everything as it comes in and what's top priority need on what we can fix and resolve.
Okay, great. Thank you, Brad. Amanda, anything to add there in terms of the threshold for making a change?
We don't have a stringent or set threshold that we need. Really, it just depends on our trends analytics. As we're looking at the data, if we're starting to see more complaints come through, if we're seeing really egregious complaints, you know, some things, they only need to happen once and we're going to fix it immediately. Like our lab technicians, a rude employee, those are addressed immediately. But bigger, more organizational topics, we tend to look for trending analytics. That way we can get the full grasp of everything that's happening and then move forward in the best way.
I love that. As you were both speaking, I was reminded in my practice one time I got a Raider 8 comment about our cast room. I worked in orthopedics, and the cast room, the person said that it looked like a storage room because we had all the DME, like we had durable medical equipment on the shelves. So I walked in the room, and for the first time I had patient eyes on rather than my eyes. And I was like, oh my goodness, this looks like a storage room. So I think 24 hours later, I think I had everything was moved and put into different spots. So it's kind of answering part of my own question there as well, because I guess it just depends, right?
Right.
So I'd love to hear from both of you about some stories where you've actually made operational changes based on the feedback that you got through Raider 8 surveys.
You want to go first this time, Amanda?
Yeah, absolutely. One of the big things that come to mind for an operational change we made due to Raider 8 was we are now contracting with Uber Health to help our patients because we have a managed care population. Our patients are a lot older. They don't really have access to their own vehicle. Sometimes a family member is not available. We also offer services through our San Antonio public system, our public transportation system, but we all know how buses are. So it's a hit or miss sometimes. And a lot of patients who are older, they don't want to spend an hour and a half to get on the bus and wait. And who knows the experience they're going to have there. So we saw that there was a really big need for maybe not our own fleet of cars, but a more transparent way of tracking patients coming in. We were also getting on our Google or on our Raider 8 reviews that patient said, I was waiting for the insurance associated vehicle to come pick me up. They picked me up 30 minutes late. We got stuck in traffic and I missed my appointment. But with Uber Health, we're able to have more visible transparency as to when that patient is picked up. And that's really cut down on the amount of no-shows that we're having, the amount of patient access issues that we're having at Gonzaba. It's having that availability on Raider 8 to read our comments. And we ask questions about our transportation service after our patients as well. So we can track and make sure they did have a good experience. And if they didn't, we can reach out to Uber Health and we can address that about that specific driver or a specific experience.
That's fascinating to me. How did you find out that patients were having trouble getting there? I know that sounds like an obvious question, but like, was there a certain question in Raider 8 that was asked, or was it just a trend of comments that were left?
I believe it was both. We have an access question that asks about, like, do they have trouble scheduling their appointment, things like that. And a lot of patients were saying, you know, I had an appointment scheduled and I missed it because of my transportation. We also have a parking lot question, and a lot of patients will answer that saying, I don't drive and I couldn't make it to my appointment 2 weeks ago because I don't have reliable transportation.
Yeah, that's really neat. I think about this thing called a service blueprint. I don't know if anybody's ever done a service blueprint, but if you break out like all the pieces, all the things that have to happen for a patient to have a visit, it's amazing how complicated it is and how many points of failure there are. And I'm not sure that I've ever gone so far back in my service blueprint that I've included their trip to the practice or the destination. So I really applaud Gonzaba Medical Group for that and thinking really outside the box and how to get their patients there. So that's a fantastic example.
Thank you.
Ron,
Brad, what
can
do
I
you got?
interrupt you
Anything?
for just a second?
Yeah, of course, Taylor.
Yeah, we have a quick topical question. Amanda is wondering whether Uber Health is something that Gonzaba covers the costs for, or if it's the patient's responsibility.
We do cover it because we are managed care. If a patient can't make it to their appointment, say it's a hospital follow-up appointment, they can't make it, then they're going to get probably sick somewhere down the line, and then we're going to pay for that hospital expenditure. So we do cover our patients because they're managed care. A lot of them have insurance covered rides under their plan. So we do exhaust those rides first before our Gonzaba, until we start picking up the tab. I know a couple of people or a couple of plans, they have like 10, 15 round trip rides. But if you're a managed care patient, you might be coming in for PT, you might have an urgent care appointment, and you can have 3 of those a month, and you're out of your insurance-based covered rides by the middle of the year, and you still have the rest of the year to get through. And that a lot of that is also when it starts cooling down here in Texas, and patients tend to get a lot of like sinus issues and chest issues. And that's when they really need to come in and be seen. So it goes insurance first and then Gonzaba Medical Group.
Great. Thank you. Brad, a little bit early, you mentioned about wait times. And I know that in your practice, you've actually had different types of wait time issues, like just the kind of the typical communication about wait times. But then there was also a really interesting story you told about waiting to check out. So I don't know, could you share both of those stories with us?
Yeah, sure. As you said, I mentioned earlier about our wait times. Our providers see a ton of patients in a day on their schedules, and so the idea isn't to reduce the schedules, but how can we minimize those wait times, or if we're still running over, how can we best communicate with our patients during those wait times? And so obviously 2 areas of wait times, right? We got the main lobby waiting area, and then we also have the exam rooms, and that's where we have some of our survey questions at. So, when our patients are waiting in the lobby, is our front office staff really communicating with those patients, letting them know if perhaps a provider's running a little bit behind, or just periodically during their wait time, touching base with them, asking if they need anything, type deal, and just updating them through their wait there in the lobby. Also in our exam rooms, typically you wait any amount of time over 15 minutes or so, you're gonna feel like you've been waiting a little while. So are we, as our medical staff, stopping by the room, checking on the patient? Do you need anything? Update them as far as where the provider is with getting to their appointment time. Also with our providers as they enter the room, even if it's minimal amount of time they're able to spend with them, what's the quality of that time that they're spending with them, and what are they communicating with them about their visit that makes them feel some value. For instance, one of our clinics, shout out to Adele if you're on the call today, she noticed an issue with with their checkout process. Instead of bringing patients straight to the checkout area, they're bringing them to the lobby first and then getting called back up to the checkout station, whereas there really is no wait sometimes at the checkout counter. So why not bring those patients directly there and let them get their follow-up visit or whatever else they need scheduled. So that was one operational issue that she was able to discover. And we might not think of it as a big one, but it, lessens the amount of waiting that a patient's having to do if there's really no need for it. So there's a lot of things that we're able to look at with all of that, communication, flow, and processes that we're able to advance just due to, patients leaving comments in the surveys. So
that's great. Well, I'll shout out to Adele as well. That's a great story. Curious, after you do something like that, after you make a change, or and this is to both of you, after you make a change operationally, and then you look at the scores from that point on, have you seen the scores improve?
Yeah, for us, as far as the checkout thing, it's pretty fresh. So we'll see how that goes. I'm hoping
to be determined.
Right.
But you have the
and then-
opportunity to do that with it, which is pretty cool, to make a change and
Yeah.
then see the data from that point on. What about you, Amanda?
I would say absolutely. We've been able, especially with utilizing Uber Health, we've been able to see our access scores go up quite a bit. We've been able to see a lot more of a holistic view from our patients of they really feel like we are managing their care and we do care about them more than just a number or you get this money at the beginning of the month. They do feel like we actually care about them, which of course we do, but it's all of that patient perception. So that from the beginning, when they start at Gonzaba Medical Group to whatever time they decide to disenroll, we care about their health. And we are able to see that uptick with our numbers, especially in regards to our providers. If we have a provider who's maybe having an off month, we're able to look at that data and bring that data to the specific provider and say, hey, I don't know what's going on with you, if you're aware of what's going on, but from our patient perception, you're seeming a little rushed. You may not be committing, you may not be doing commit to sit, you may not doing that first touch with the patient. Just so you know, these are things you can work on. And generally, once we do speak to the provider about that, or even their MAs, we do see an uptick in the scores we're getting for that group of providers and the MA, and we get better feedback.
So tell me, what is commit to sit? I think I figured it out, but what does that mean?
Yeah, commit to sit is the action of the healthcare provider actually sitting down with a patient, whether it's across from them, and it really instills a feeling with the patient that this person is here. They're not thinking about something else. They're not standing up right next to the door, ready to go to their next patient. They're taking that time to sit down with me and talk to me and make sure that I feel okay. They're not trying to get out of here as fast as possible. And it typically, you only need to sit for maybe 2 to 5 minutes, but it instills that action of sitting and relaxing and taking the time with your patient.
I love that. I think that a little bit of coaching for the providers goes a long way. I know I had issues with providers who were scoring poorly with, spending enough time with them.
Mm-hmm.
And just adding the question at the end of the appointment, like, is there anything else I can do for you before I go? And then pausing and waiting was enough to change the scores, and it didn't really slow the provider down all that much. I think sometimes they're afraid of asking a question like that because then they're like, well, yeah, I've actually got a problem with my knee too. And but for the most part, it goes pretty well. Amanda, I think you had shared with me a story about your call center, and there was a wait time issue there. Is there anything to add with that?
We did have issues with our call center. It's entirely in-house. So it's all Gonzaba employees taking care of the patients. And there has been an issue of less personnel than we really are looking for. So our call center times have gone up, but we're able to address that because at the end of all of our patient surveys, we have a call center experience question. So we're able to track that patient's experience with the call center. And that's how we know wait time is an issue. And whether it's a true wait time or a perceived wait time, we are able to follow up with the patient and address their concerns.
Fantastic. So question for you, Brad. There's a lot of reports you can get in Rate that show like all of your providers, and it kind of will rank them. So to a degree, you could put those reports in front of providers. And I'm just wondering from a strategic standpoint, do you put those reports in front of providers? An occasion I have, but I understand that some practices don't. So I'm curious how you handle that, Brad.
Yeah, so up to this point, I don't believe all of our providers have really been presented that data in that form, as far as them being able to see really how they stand up against one another. However, I know they do receive the what's that report called? I have it all pulled up, the patient feedback summary report that each provider gets monthly. And I know some of that data in there will show them their score compared to other providers within our clinic, also other providers within the Raider 8 system. So they are monthly able to see that information, as well as if their practice administrator so chooses to present that information to them. They have the ability to do that as well. But as far as just totally providing a screenshot or report to them, just compare provider to provider, hasn't really been anything that we've set up at this point. Not to say that we might not. That's something that we've really been looking into lately, is getting our providers more involved with the patient experience and getting them plugged into our initiatives on raising our patient experience scores and different things like that. So it might be something we present to them at a certain point in time, just not up to this date just yet.
And I love that you probably can, like when you see a trend towards a lower score, you can coach the person. But one of the things that I loved about that monthly report that you just mentioned is, like, if I felt like I wanted to talk to a doctor, about half the time they would come to me because they got the monthly report from Raider 8 and they wanted to brainstorm about how they could do better with a specific area. So I think those reports are really, really powerful. Amanda, do you have anything to add on that? Not to put you on the spot.
No, you're fine. Yeah, we go to each location, all of our 7 locations, and we present the data for those providers. We don't include provider names, so they're not really seeing how they're ranking against each other. At that point, when we come in, we're trying to look at Gonzaba as a cohesive unit. We're not trying to pit anybody against each other. That's kind of a different way that some people go. But for us, we put everyone together, and just like Brad, they do have their personal feedback summaries that they get each month. And then some of our administrators print out their NPS score and all of the comments associated with them, because we know not all of our providers utilize the feedback summary. So our administrator will print out that data and present it to them. That way a provider a year down the road can't say, why do I have such a small panel? All of my patients are gone. And we can say, hey, you've had these comments, things like that. We don't, to answer your question, we don't look at it one by one, but we look at it as a group, and we present that data by location and sometimes even by department. For PT and our PM&R, family practice, they're all separate. Urgent care is separate. That way they're getting the most applicable information for that location and department.
Okay. I'm actually feeling a little bit guilty because I have put those reports in front of providers before. I don't know, maybe it's just in the orthopedics world, they're so competitive that if I really want to, like, if I really want somebody to change, I just have to show them that they're not used to being the bottom of anything, of any list.
Yeah, I get that.
Yeah, I see it.
Amanda, you had shared with me a couple of stories, and Brad, you can jump in as well, because I think sometimes there's just these one-off things that come through on a survey. So it's not necessarily an operational change that you have to make within the organization, but it's just being aware of something that happened so you can fix it, kind of like a service recovery opportunity that you take advantage of. Anything that you can relay with those types of experiences?
Yeah, absolutely. So with Uber Health, we're able to track the patient experiences, especially when a patient will message us and say something, I left my purse in an Uber car. And then even though it is the patient's responsibility to get their things back because they left it, as patient experience, we really try to be that mediator. I've driven, let me see, I drove one time an hour away to go find a purse that had been missing. Turns out it was the wrong car.
Oh,
But
no.
yeah, but then once we actually got the purse back, and I hand delivered it to the patient that had lost their purse. It had everything in there. She lost her phone, her social security card, her credit card, her ID. So I hand delivered it to her at her house. That way she knew, we cared and we wanted to deliver that back. One thing we had happen with us that we were only able to know because of Raider 8, a patient had come in with a very expensive Yeti cup and lost it somewhere. It was never recovered. And we were able to refund and mail the patient a new cup. That way they knew we weren't trying to take advantage of them. We cared about them. They cared about the cup. So we were able to forward the cup out, and we were able to buy a new one and forward that cup out to the patient. And that totally changed that patient's point of view about Gonzaba. It was a really cool experience to be able to change that patient's mind and keep them as a patient.
Great. Well, what a wonderful example you're setting for us all about just kind of going above and beyond for a patient, driving an hour, then realizing that, it wasn't even the right car, and then getting it and then bringing it, so that you invested a lot of time in that. And I know that patient appreciated that. So that's fantastic. Brad, anything to add to that?
Man, I'm sure we got some practice administrators out there that, probably has some good examples of that. I know specifically here for myself in Morgan City. I haven't had any patient comments with lost items in them to be able to do anything like that.
You've never driven an hour? That's okay.
No,
just
not,
kidding.
not just yet.
Neither have I.
I mean, other than small service recovery type stuff,
Okay.
Patients may express concern with the staff member or something like that, being able to go back in history and recover those situation type deals. But just nothing specific really I can think of myself, but I'm sure those stories are out there within CIS.
I'm sure they are. You shared a couple of great kind of non-monetary rewards that you do with your staff when they get mentioned in surveys and things like that. Can you expand upon that?
Yeah, sure. We this past year we had a few clinics start. If a staff member happens to get their name mentioned in a patient survey, they would get a little reward for that for the month. So that didn't really matter the amount of times that your name was mentioned, just as long as your name was given a shout out in the patient surveys. So a few of the clinics kind of started doing what they called the cupcake break. And those respective staff members would be rewarded with the cupcake for the month. So we kind of seen it take fire a little bit within some of the clinics, and staff members really promoting the surveys, mentioning the patients, hey, by the way, you're going to get a survey, wouldn't mind name dropping me kind of deal. And I know personally for my clinic here in Morgan City, we really started seeing our response rate, grow a little bit. From surveys being promoted. And so as an organization, our corporate office and all that, my boss, everything, the regional practice management, ladies and gentlemen, they, put their heads together. Let's come up with something as an organization, kind of standardize this reward for our employees. And so what we do, we have store points where our team members can log on to our online store. They can purchase merchandise or turn in their points for reward dollars towards gift cards and different things. And so we just started doing that, get your name mentioned in a survey. You're going to, at the end of the month, get a point reward towards our company store so that you could utilize that. And this is kind of a little bit of a newer thing that we've started. And so we'll see where that trend continues to go, but we have seen some positivity from it so far.
That's fantastic. So a question for you, Amanda. You mentioned the patient advocates earlier. Are there any incentives for them in terms of how well patients are doing on Raider 8? Like, are they tied to the performance of the practice?
Not in an operational way. We do have something similar to what Brad has. We call it our Como Familia call out program. And just like Brad, if a patient or an employee is mentioned by a patient, they receive some recognition. We also have a little storefront where we get them points on there. It's kind of been revamped, and it's become a virtual dashboard as well as a physical dashboard where the employee and their comments are posted in a public place. So everyone can see the great things that they do, especially for our patient advocates. They see a lot of patients every single day, and they help them with things from transportation. They help them with billing. Sometimes a patient will just come in with bills that they get in the mail, and our patient advocate will help them sort through the mail, because it really is a managed care experience. We're really there for our patients. We try to be in every aspect that they need us to be. So although we don't have a organizational or an SEO type of look for the incentive, we do promote and advocate for all of our employees.
Now, with your patients being older, and I've been meaning to ask you this because you've mentioned that a couple times, how does that impact your response rate to surveys? Because we hear that a lot. We hear that's like, well, we have an older population that don't really they're not as advanced to respond to the technology. So I'm curious what your experience has been.
Yeah, so this last year, 2023, we actually had our highest response rate that we've had. It was around a 23 to 24% response rate, which we consider to be very, very good considering our patients are older. We do utilize the text feature first, and then we go to email as a backup if that patient doesn't have the correct information, or maybe they gave us a home number instead of a cell phone number. We also, because we're down in San Antonio, Texas, we have a very high Spanish speaking population. So we are working on paperwork to give to our Spanish speaking population about how to translate the surveys on their phone. It's actually a Google thing that they can do. So we're working on that. We've just moved to surveying our palliative care patients, and a lot of those are not bilingual patients. They are only Spanish speaking. And we're working on improving that response rate with our new paperwork, so we can explain to them, hey, we do still value your information and your feedback, and this is how you can really give it to us. We also, on our patient advocate side and on our own patient experience side, we have bilingual employees, so they're able to converse directly with our patients so we can get as much feedback as we can.
Wow, very impressive. So I'm curious, this is a question to both of you. I'm curious about, because of the complexity of your organizations, right? I mean, between the two organizations, you have 27 locations, you have over 120 doctors, both of them about 60 or so physicians. It translates to, like, you could be considered a private practice, you can be considered a hospital. You know, you're kind of in the sweet spot with your size. How do you decide what questions to ask in surveys, and how do you differentiate those surveys by location, by specialty, kind of across your organizations?
I'm going to go first on this one, Brad, since I'm already on here. I think for us, we really rely on the administration for each department and location. We know we're able to do custom questions as well. So if they're really curious about, I don't know, with our palliative care, we were able to create totally custom questions about pain, about depression, things like that weren't on Rater 8 previously. But now those specific questions are on our Rater 8 surveys for palliative care. We really depend on the administrators. We'll go to the providers, we'll go to the MAs that we have to find out what questions and what data is most pertinent. Of course, we always keep our NPS questions. Those are on every single surveys. But if maybe urgent care is really worried about their wait time, we'll make sure wait time is on every single survey and it's not in that rotation of questions. Mm-hmm. So we really try to find that low-hanging fruit, the things that sometimes a department will say, hey, I think our portal is not doing that great. Can we get more feedback on it? So we can move forward with that and we can start gathering more data. But it really just depends on our leadership.
Love it. What about you, Brad?
For sure, definitely pretty close to the same thing. We've been pretty standard with our questions across the board since we've been with Rater 8, as far as what's asked on every survey and then kind of what goes through each one custom. I know we have a little bit different questions for our cardio at home program that we have with telecardiology virtual care, stuff like that. That's a little bit different than some of the questions we would ask for patients that are actually coming into the clinic. We have been looking a little more recently at, how frequently some specific questions are being asked. I know, like Amanda mentioned, if they're having an issue in a certain clinic area, we're starting to look a little bit more at, do we need to ask certain questions more frequently. So, that's just kind of how we've gone about it so far up to date.
Okay. So I think I might have two more questions for y'all. This is about low rating alerts. So low rating alerts are the emails you get if somebody scores you on the survey as a 3 stars or less. I'm curious because I haven't worked in organizations as big as yours. So I used to average maybe 4 or 5 low rating alerts a day. Me and a couple people could handle them with just communication amongst us. With the size of your organizations, how do you coordinate low rating alerts, and how do you make sure that things don't fall through the cracks?
Yeah, so for us here, we have those low rating alerts go to the different practice administrators at the respective clinics. Whichever physician that survey that comes back that has a low rating, whichever clinic that visit or that response is tied to, that practice administrator is the one that's going to be receiving that low rating alert. And it's, their responsibility at that point to circle back around with either the provider or staff or whichever question it is that's being low rated to take care of that. I know for myself here in Morgan City, shout out to my doc, we don't get a super whole lot of low rating alerts. But I open them up, I look at them, and as we need to take care of them, definitely do that. So like I said, just each practice administrator of each location, their responsibility, take it upon themselves to handle those.
Okay. Amanda?
For us, it's a little bit different, but the same. Our patient experience department is on every single low rating review that comes in. So our patient experience coordinator, she will go through all of our reviews. She'll put the ones that do have that patient identifying information into our complaint dashboard. And we have a separate employee. He will go through all of those complaints. He'll determine the level of complaint. We range from routine to urgent. He'll give it a tag, he'll give it a location and a department, and then it'll be forwarded off to our leadership team. And then he'll follow up with our leadership team to make sure something's being done about the complaint. Something like the light was off in the bathroom. Those are routine, and our employee can handle those on his own. He can reach out to facilities, but for something where maybe a patient's really, really upset, he does default to the leadership, because that's normally who a patient wants to talk to anyway. They want to speak to the manager or the coordinator for the clinic, but he is involved to make sure that there is follow-up.
That's great. I always felt like low rating alerts were either actionable or informative, right? So there's some that you don't have to do anything about, and some of them it's like, okay, we need to do something right away. So it's great to hear that you both have sophisticated systems for handling that. I think we have a couple of questions. We're getting close to winding down. I had one more question I'm going to ask you both, and then I think we'll go to the questions that are in the QA part of the Zoom. So let me just throw out this question to you both. I guess I'm curious of what's your favorite part of Raider 8? Like, what's the part that you feel like you couldn't live without?
I'll go first. I really like the customization of Raider 8 and the ability to interact with your account manager to make it work for your own clinic or hospital, whatever you are. They really care about making sure this information and data is worthwhile for you and that you're going to find actionable consequences for what you're pulling in. We have quarterly meetings. If you ever need anything, everyone's just on top of it. That's probably my favorite part. Is they are a great company to work with. They understand how important the data is, and they want to make sure that you're getting what you're looking for.
Great. Thank you, Amanda. Brad?
Yeah, I think that's an amazing aspect that Amanda brought out. You know, we just had literally had a call this morning with Parker, Evan, and Sam, and like she said, just making sure everything's taken care of. The support is immediately accessible. It feels like send them an email, whatever you got, they're answering. Generally always same day, if not within the hour, type deal. So support is just awesome and amazing to work with, as she said. You know, of course, we have some of our favorite dashboards and benchmark analysis, analytics dashboard, some of those new business intelligence modules that came out, pollen analysis type stuff are all very good as far as the data goes. But I would 100% agree with Amanda on how easy it is to work with Raider 8 and their team.
Yeah, and if I could speak, because I know I work for Raider 8, but as someone who was a client, I would share that I really loved that the kind of the nexus between building online reviews and kind of having that unified patient feedback platform, having all that information in one spot. So I didn't feel like I had to look all over the place, and I could with confidence know that I wasn't missing something. You know, it's all right there for me to look at and digest myself.
Yeah, I love the kind of going off of that, the integration with Google reviews and WebMD Vitals, everything all in that one spot. You can respond to Google reviews within the Raider 8 system, and yeah, it just makes it really easy, simple.
It's great. I'm going to go to the questions. Let's see. I think Taylor may have asked one of them. I'm going to just start at the, let's see. Okay, Amanda, what is the criteria that patients need to meet to be offered Uber Health?
So they have to be a managed care patient. We do have a certain parameter for distance of how far, because some of our patients, they live very far away from us. And unfortunately, we do not offer Uber for those rides that could be $90+. They have to have, you see, off the top of my head, they had to have like an appointment scheduled. The first one is they have no more insurance rides in most cases, unless it's an urgent issue and the patient needs to come to our urgent care. We'll take care of them. I have a list somewhere where I can pull that up for you. I don't have it at the moment, but if someone really is interested, they can send me a message on LinkedIn and I can collaborate.
All right, wonderful. Another question, other than wait time, what are the next 3 questions you find most helpful when trying to understand what a patient experience is like at your practice?
You want to do that one, Brad?
Yeah, I can. So like I know our star rating here that we base most of everything off of is, would you refer us to a friend? Which also closely ties in with rate your provider. So those 2 questions are asked on every single one of our surveys. Wait times, of course, are a big one that was just mentioned in the question. We look a lot at, I'm trying to breeze through our benchmark analysis real quick. I know another one, you know, where your questions and concerns addressed, you know, that's that communication with the physician for each visit. Then you have all your basic ones that, of course, we still look at as well. Office cleanliness, staff friendliness, you know, those are some of the low-hanging fruits that we should be able to take care of. But I would say those other ones are of course, our top ones here at CIF.
Okay. I think this is another question for Amanda. If you are able to save / keep 100 to 140 patients out of the 300 that had left, how does this impact their revenue bottom line? And then kind of expanded a little bit, just says, if a primary care patient has a lifetime value, does this quantify into actual savings within the organization?
It does. Unfortunately, I don't have that data to distribute at the moment, but because we are managed care and we do get that fee per month per patient, we are able to, if we're able to keep our patients, we're able to take care of their care much better, and we are able to retain a little bit more of that monetary value.
Okay. Great. And then this last question, I'm not 100%, I'm going to read it, and I don't remember it, but you mentioned service, and I'm not sure if this is related to Amanda or Brad, but it says you mentioned service-related deflections by patients could you clarify what service related means? I apologize that I don't remember that being said.
I think this was when Amanda was discussing, similar to the last question about some patients, 300 maybe you lost, but you got 140 back. But some of those patients moved away or perhaps passed away. So,
Gotcha.
But what would be an example of like a service related, like somebody left?
Yeah. So some reasons that our patients do leave would be bedside manner. It might be access. It could be billing issues. Maybe there's something RNs we just could never figure out, and the patient got tired of it and left. Our main ones are probably access issues and bedside manner, but in comparison to our non-service related, which we called NSR departures, they really pale in comparison. But bedside manner and access, I'd have to say those are probably the #1 reasons why patients do disenroll.
Great. Well, that's pretty much all our questions. So I just want to make a closing point. I know sometimes as practices get bigger, they go from being smaller to bigger, and they go from being like family to a more factory feel. I really want to applaud Amanda and Brad and their organizations because they've hung on to family. Like I really feel like that they've taken the patient feedback to heart, and they truly do care. And that's the message that's being communicated, is that they're processing the data and they truly do care. And I'm sure on the other side of the Rater 8 service that all comes through on the Rater, on the online listings, right? The online reviews are really positive for all your organizations, and those comments reflect that kind of family experience they have in your practices. So I want to applaud you both for having that type of an organization. And thank you both for being part of this today.
Yes, sir. Appreciate you having us.
Thank you.
All right. Thank you guys so much again for participating. Thank you, Ron, for leading the way. And for the rest of you, thank you so much for attending. You will receive a link to the recording in your email on Wednesday morning. And until next time, have a great day.
Bye, everybody.
Thanks, guys. Bye.